Hello again, this is Captain David Dalton, and today I would like to speak with you about behavioral restraint. I want to start by letting you in on a little secret. Despite how common it is for EMTs and paramedics to use physical restraints in the field, the truth of the matter is the vast majority of us receive little, if any, training in the practice whatsoever. So stick around, because the information you're about to see is both shocking as well as way overdue.
Don't touch me. Freeze, okay?
Get your hands off. Get your hands off me, thing, Tom. Good. Don't whoa. All right, this shoulder. Ooh, elbow.
Oh, watch the elbow. Elbow.
Yeah, it's really hard. Oh my gosh!
Wrist in the shoulder, wrist in the shoulder.
Pressure point.
Wrist in the shoulders.
Bad boys, what you gonna do? What you gonna do when they come for you?
What's going on today? I just want to hurt myself and other people.
Dead or alive, you are coming with me.
Capital Engine 01, ALS upgrade for combative patient and have law enforcement respond priority.
Thinking back on your days in EMT school, paramedic school, or the firefighter academy, how much training would you say you received in the practice of physical restraint? Was it 4 hours? Maybe only 1 hour? Or was it even less? Don't feel bad if you fall into that category because you're in good company.
How much restraint training do you think you had? None?
I mean, I don't mean restraints. We learned how to document restraining a patient.
That's common, yep, the documentation.
But I don't think we ever learned how to actually restrain.
Over 90% of EMTs and paramedics say that in EMT school and paramedic school, they received a grand total of between 0 and 4 hours of restraint education. And about a third of that is actually 0. But now let's just say for argument's sake that EMT and paramedic school simply didn't have enough time to give adequate education in the use of physical restraints. Fair enough. Surely then, once you went to work professionally, you've received a lot of training in the use of physical restraints, right? How many years do you think you've had some form of annual physical restraint training? And I'm not talking about the kind that you get rolling around in the back of an ambulance trying to actually get a real live patient secured to a stretcher when they don't want to go to the hospital with you. I'm talking about formalized training. Has it been maybe only one time since you went to work? Or are you, like over half of all EMTs and paramedics, in the same situation where you've received no ongoing training whatsoever? This is Brett, 21 years old, college student, All-American athlete, but like so many others before him, Brett has begun to struggle with major depression, to the point where one night it gets so severe that he begins hearing voices telling him to kill himself. He's taken to a nearby hospital, and the following morning, his nurse arranges to have him transferred to a psychiatric facility. When EMS arrives, they receive report from the nurse who says that Brett has been the perfect gentleman, compliant, very polite with the staff, no problem for any of them whatsoever. But the ER physician continues to perceive him as a flight risk because he was admittedly suicidal. The EMTs go into Brett's room, introduce themselves, and take Brett out to the ambulance. In the back of the ambulance, the attending EMT secures Brett's wrists to the ambulance stretcher using a pair of soft restraints. The driver gets up in the front, and so begins their journey. So far, this trip is indistinguishable from thousands of others, just exactly like it. It's run-of-the-mill, it's perhaps you might say mundane or even boring. We've all run dozens and dozens of these trips, perhaps even more. But like Murphy's Law states, if something can go wrong, eventually it will. About 10 or 15 minutes into their trip, Brett looks over at the EMT who is seated on the bench seat right next to Brett, and he says, I don't want to sound rude, but having you sit right next to me like that is making me very uncomfortable. Would you mind to sit in the chair that's back behind me? And the EMT says, "Oh, sure, no problem." And he gets up and moves to the captain's chair, positioned behind Brett. Well, a few minutes pass, and the EMT looks up and sees that Brett is standing straight up in the back of the ambulance with both wrists free of the restraints. He quickly grabs hold of Brett, trying to keep him inside the moving ambulance. The driver up front hears the commotion, pulls over to the shoulder of the road, and radios for help. Brett manages to break away, exits the back doors, goes across 7 lanes of interstate traffic, and seemingly on to freedom. Now, it just so happened that there was an off-duty police officer nearby who sees all of this and gives chase. He catches up with Brett in 10-15 minutes or so, and once he's had a chance to talk with Brett and get him to calm down, he begins to walk him back toward the waiting ambulance that is parked on the shoulder of the road by the interstate. Well, they get just a few steps away from the road when Brett suddenly pulls away from the officer, steps into oncoming traffic, and is struck by an oncoming pickup. "18 months later, the attending EMT who had ridden in the back of the ambulance with Brett finds himself standing in a courtroom where a jury has just declared him grossly negligent and has awarded Brett's family a $1 million judgment. Now, perhaps you're asking yourself the very same question that entered my mind the first time I heard this story. Why gross negligence? Was the jury's decision based on their belief that the EMT had an obligation to keep Brett in the back of the ambulance at any cost? Was the escape itself the problem? Or did the jury feel that the EMT had improperly restrained and then improperly monitored the restraints? You see, the jury felt that the EMT had made at least 2 grave errors. The first of which was, in their estimation, improperly or incompetently applying the restraint device itself. Now, I have no knowledge of what particular restraint device was used in this case, nor do I know how it was used, if the EMT followed the manufacturer's instructions. What the background is on that, I just simply don't know. Regardless, the jury felt that the EMT had acted incompetently. Secondly, the standard of care then and now dictates that any time we restrain a patient, we must at all times maintain an unobstructed view of the restrained extremities and the restraints. The EMT had breached his duty when he moved from the bench seat, a position that offered him a clear view of the restraints, to the captain's chair behind Brett, where, with Brett positioned in the semi-Fowler's position, completely blocked his view of both of Brett's wrists. And the jury felt that if not for those 2 decisions, Brett's death arguably could have been prevented. There is no happy ending to this story, and there are certainly no winners. Regardless of the $1 million judgment or any of that, I'm sure it was very little consolation for Brett's family. And I can't help but wonder, if not but for the grace of God, could something like this happen to you or I? Have you ever transported a psychiatric suicidal patient? Have you ever seen a patient escape from a restraint device? 3 out of 4 EMTs and paramedics say they have witnessed just such an event. Now, this number is far too large to be dismissed as a simple handful of EMTs and paramedics that just need some remedial training in the use of physical restraints. This is a surefire sign that we have a system-wide problem in EMS. EMS as an industry has failed us, failed you when it comes to restraint education and the restraint devices available to us. I'm sure the EMT in this case would tell you that all it takes is just one bad day. He wasn't trying to do something reckless. He wasn't trying to cause harm to his patient. He simply made an error, an honest mistake. It was just one bad day, and his career was over. I wish I could tell you that Brett is an isolated case. This next video is of a young man by the name of Adam Lynch. He is living in a group home with other intellectually disabled persons, and you're about to see some security footage where he gets into an altercation with a staff member who has just told him that he needs to sign out before going outside for a smoke break. Adam shoves the staff member, and then things pretty much spiral downward from there. Now, in that video, was a single restraint device used? No. Was Adam ever hogtied? Was he ever sandwiched between two backboards or transported to the hospital in the prone position? He was held in the prone position by the staff members, but for how long? Less than 4 minutes. And I guarantee you that the staff members involved probably didn't feel like 4 minutes had passed. With their adrenaline pumping, it probably felt like seconds. And it's not like someone was standing there with a stopwatch saying, "Oh, guys, we're approaching 4 minutes. It's probably been too long. You need to stop." None of the usual things that we were taught never to do apply in this case. Adam didn't die while in restraints. He died in the process of being restrained. Call it death by dog pile. And sadly, Adam's not the first and certainly not the last. Over the years, there have been dozens of cases exactly like this. Persons who died long before a single restraint device could be secured. And restraint-related death is no respecter of persons, not age, gender, race. Everyone is a candidate to be a victim. Without question, the scene is not safe for our patients when it comes to restraint. But it's not exactly wine and roses for you and I either. The number of lawsuits seems to be on the rise. It's not just cases of patient death that we need to be concerned with, but also civil rights violations. And civil litigation isn't the end of our legal concerns. In a recent case, there was actually a prosecuting attorney who considered filing murder charges against an EMS crew whose patient died in a restraint-related disaster. Now, thankfully, the prosecuting attorney in this case relented, but I truly believe that left unchecked, it's only a matter of time. Physical restraint is one of the most predictable settings for an assault on a provider. And it's been said that if you can predict something, it can also be prevented. Have you ever been assaulted while trying to restrain someone? 80% of EMTs and paramedics say that they have.
A man accused of the beating death of a Cox Hospital security guard is found guilty. Good evening, I'm David Oliver.
And I'm Joy Robertson. Today, a Boone County jury found Jeffrey Bolden guilty of second-degree murder and assault. This after a change of venue in the trial that started earlier this week. In August 2008, Bolden was brought into the emergency room as a suspect in an arson. Prosecutors say he kicked hospital security officer Monty Ruby in the head after Ruby tried to calm him down. Ruby died a few days later.
This event took place at Cox Hospital in Springfield, Missouri several years ago. The assailant was brought to the hospital after being bitten by a police dog in the course of being arrested for arson. At the hospital, his hands had already been restrained by law enforcement, and the security officer, Monty Ruby, was trying to hold the assailant's leg in place to get it restrained to the hospital bed. The assailant managed to pull his leg back, bending his knee, and then thrust it forward, kicking Monty Ruby in the head. Officer Ruby succumbed to cervical trauma and head trauma. Before we watch this next video, I want to give you a little bit of context first. At St. Charles County Ambulance District, we began teaching a course called Escaping Violent Encounters several years ago. And in the past 10 to 12 classes that we've held, I began experimenting by having a group of 5 paramedics come to the front of the classroom where I had a stretcher and a patient sitting perfectly still on that stretcher, and I would give the group of paramedics a set of the very restraints that were carried on their ambulance and had been carried for between 10 and 11 years. And it did not matter whether the paramedics were 30-year veterans or brand new medics that had been employed with us for less than 3 months. Every single case looked exactly like it does in this video. I say that because this is not intended to be a condemnation or critique or ridicule of the persons shown in this video. They aren't the ones who failed. If anything, EMS as an industry has failed them, just as it has thousands of others. Take a look.
This is the device that is on your truck for patient restraint, correct?
Yeah.
Yes. Yeah, these restraints, I'm going to tell you, have been on the truck for about 10 years. Okay?
Yeah.
All right.
But then we need this to get down.
Yeah, no, his shoulder comes up, his hand comes up. So they're ready.
Okay, what's the problem with this?
It's too long.
Too long. Okay.
He's got too much range of motion.
Too much range of motion? Okay.
That's how I messed up. I needed to put it on the extremity and then attach it. Now you're limited on options.
All right.
You got that in there good.
Oh, it's just a couple backup knots and an 8. It's not that
Could have
bad.
touched it. Oh yeah. Other side, I guess.
So,
I guess we could have crisscrossed
what are you
it.
planning on doing with the D-ring?
Just go like this.
How are we doing up here?
Still securing
Yeah,
it.
but that's not
Okay.
the proper ways to have it.
Well, yeah, I was going to anchor it and then we were going to figure out how to put it on.
That's that
But
like
then there
that.
was another idea brought up, so we're going to try something else.
Okay.
So then we can anchor it to maybe
mine.
slide through here.
I had it between here.
Move whatever you gotta move.
Okay, we got one done. One ankle. Okay.
That's why I had to wrap it.
Is that good?
Don't forget your regular seatbelts.
Are they even all on this?
That's what we got here. We got. All right.
These are the old.
We got. Geez, what on earth we got going here?
You got waist one, so
Yeah.
you gotta tighten it up for me.
This doesn't
chest.
crisscross.
I just wrapped it around in one
You just
spot.
strap it.
Yeah,
Then
that's what. Yeah.
Right, I
Okay.
know how they go. I just it's here, it's missing.
Okay. Let's see. So we are at 6 minutes 15 seconds. And if you had a combative patient, is he going to sit still for 6 minutes?
We would all be really tired right now.
So, are we comfortable with this? We feel like we've done the adequate job? Are you able to free yourself?
In about 10 seconds I will be.
Oh my gosh, he's just reaching up there and untying it, one-handed. If you're heading down the road, would he be able to get out of these? Oh. Successful or unsuccessful use of restraints. And I'm not saying this to pick on you guys at all. This has happened in every single class that we've tried this in.